This is 7th Street in Melville, Johannesburg, usually one of the city's most popular places to come socialise, dance, drink and smoke. But for well over a month, not a single beer or packet of cigarettes has been sold here, legally anyway.
Legal beer was back, a long time between drinks.
The prohibition on alcohol and cigarettes here is part of a raft of restrictions on consumers aimed at curbing the spread of coronavirus. The South African government, in justifying its decision, framed drinking as an impediment to social distancing and also pointed to its links to risky behaviour, domestic abuse, accidents and violent crime.
He's a drunken driving arrest.
With a high incidence of various diseases nationwide, it raised the alarm that millions could be more susceptible to catching the disease if drinking and smoking continue unabated. But above all, government said it needs to free hospital beds, and trauma related to alcohol is known to fill up emergency rooms.
We've certainly shown through our modelling that we're probably saving just under 5,000 trauma beds per week through the banning of liquor sales in South Africa. How many can we fairly confidently say we're saving because of the lockdown measures on alcohol? It's about 15 deaths per day. But if you multiply that by the number of days of the lockdown, over 35 days, the mid-level figure would be 515 lives saved, which is substantially, probably double what we're seeing in terms of lives lost so far from COVID-19.
But this is little consolation to people who rely on alcohol and tobacco sales to earn a living.
That's a really problem for those on which are surviving through the alcohol, through selling alcohol. It's a pity for them, but at the same time, alcohol, that is a problem in our country.
People are drinking here a lot, so if you guys are opening the alcohol bags, a lot of families will struggle for food and stuff like that.
A flatlining economy has also prompted criticism the ban is robbing the fiscus of much-needed tax revenue, right as authorities have ramped up emergency social spending. Combined excise duties on beer, wine, spirits and cigarettes in April amounted to about $19 million. Overall, that's a very small part of the budget, but tax earnings are way down and the collector needs every cent that they can get. To make matters worse, the tax commissioner warned the ban may also be helping illegal trade fill the supply gap.
Okay, we're losing something in excise taxes, but what are we gaining on the other side? We find that there'd be a savings of about 900 million just in trauma savings alone. From a syntax point of view, it's generally well known, not only from research in South Africa, but other countries, that the costs to society broadly, the health and social costs, are roughly double what we get in excise tax and value-added tax. We think of the short-term taxes that are coming into the fiscus, we don't really work out what are the other costs of having it. And I'm certainly not saying we should get rid of alcohol, but we need to have some conversations about how we can have a new normal and what it might look like.
And thank you for all that you've done.
Other criticisms, meanwhile, include that government has overstepped with a range of lockdown restrictions. The leader of the opposition, for example, went so far as to say that authorities are treating citizens like children by imposing several irrational rules. He called the ban on tobacco in particular draconian after government initially lifted the ban after 5 weeks, then backtracked a few days later.
People might think I support prohibition. I've been called a prohibitionist on Twitter, but I'm not. I consume alcohol and I don't like people telling me what to do. But many people are living in very crowded, difficult circumstances, and the government can't have different policies for different socioeconomic groups. We have to look at the way drinking occurs. More wealthy people drink generally than poorer, but their burden is higher amongst the poorer sectors of society. When you're limiting people's liberties, I think governments do better when they take the population with them. I think it's very important to share scientific information. We need to do more of that with alcohol particularly, and also with tobacco. We haven't done that, managed that PR process well. Certainly, I think we all thought that the cigarette ban was going to be lifted, and we really just had the population told to go cold turkey without much support. And I think a caring government, it would be good to see showing some empathy for people who are struggling with this, rather than having the image being a law enforcement image. If we catch you, we're going to lock you up, and we don't need it.
The legal sale of cigarettes and limited sale of alcohol is only expected when a more relaxed phase of lockdown is implemented. And when that happens is still anyone's guess.